We are Team Aaida. Oops. And I want to tell you Brent's story. Brent was diagnosed with autism, and actually coming to this diagnosis was really challenging because autism is seen as a spectrum of disorders, and the manifestation of symptoms can actually look different in each individual. But common to all diagnoses is challenges with social communication and interaction. After Brent received this diagnosis, his family looked at their treatment options. And like the majority of children diagnosed with autism, it was recommended that he receive applied behavioral analysis, commonly referred to as ABA therapy. And this is really the gold standard of treatment. It teaches behaviors using a reward-based system. And it has the most research to support positive outcomes throughout the child's life, especially with early intervention. But unfortunately, at a cost of $120 an hour and an average recommended intensity of 25 to 40 hours a week, families feel overwhelmed both emotionally and financially by this burden. And I know this because Brent is my nephew. And I know that families struggle to decide to limit, delay, or forego treatment entirely. And Brent's family is not alone, because in 2018, 1 in 59 children were diagnosed with Autism Spectrum Disorder. And at Aaida, we spoke with some of these families, and we tried to figure out what solution can we develop for them. What we came up with is an affordable and engaging platform that provides evidence-based therapy for children living with autism spectrum disorder. And we do this by delivering therapeutic exercises using software. And this really categorizes us as a digital therapeutic. Our delivery model actually starts with a clinician using standardized assessments to identify what specific behaviors a child needs to learn. From there, the clinician can go onto Aaida and search for this specific skill. What they'll find is a curated list of therapeutic exercises that we have gamified that will actually teach the child these behaviors. Something additional that we've done is we've actually matched each one of these challenges to a classification system called ABLE that can be used for both reimbursement purposes as well as measuring and tracking outcomes. So once these challenges have actually been assigned to the child and are relevant to them, they can actually begin to engage in these challenges. Now, we've worked with autism specialists at the University of Michigan to storyboard out challenges for the most common skills that children with autism spectrum disorder need to learn. And we paid specific attention to what game mechanics have already been demonstrated to actually modify behavior in children living with autism. Now, when we did our customer discovery and we talked with families, we heard over and over again that caretakers were not sure how to be the most effective members of their care team. With Aaida, we've developed a platform that has a dashboard that will let parents and caretakers know what's the priority that the child is working on, what's the progress that they're making in the game. It'll curate discussion questions that will actually reinforce the knowledge that they're learning, and it'll also have a unique feature called in real life challenges. Now, this will ensure that the knowledge that's being learned in the virtual environment actually transfers over into reality, and the parent will be able to report back on the progress that the child is making, allowing us to measure and track outcomes. With Aaida, our platform allows for affordable, accessible, and engaging access to evidence-based care for children living with autism spectrum disorder.
So the Aaida platform allows stakeholders to share otherwise decentralized information and collaborate on patient care. But why a game? Research labs out of UCSF and Yale have demonstrated the efficacy of gamified therapy on behaviors, and that validates that we are in the right space. But these labs are not our direct competition because they're not commercializing products to treat social behaviors. Other competitors are either focused on education or are not tied to outcomes and are therefore not evidence-based therapy. As Chanel mentioned, behavioral and social challenges is the only common thread across all autism diagnoses, and we believe that there's a place for us in this market. So, how big is that market? How sizable is this opportunity? Based on prevalence and cost of care, we've calculated the total addressable market to be nearly $50 billion per year. And given the wide severity of autism, we've decided to focus on a subsegment of the population that has the capacity to engage with our product, bringing our serviceable addressable market to nearly $14 billion per year. Now, even at a conservative estimate of a 5% market capture, our market is still $700 million per year. But we expect this number to be higher because our product improves access to those who otherwise don't have access or can't afford traditional ABA therapy. We plan on selling directly to ABA therapists, marketing that they'll be able to see more patients and track outcomes. From there, we can expand and develop games for other age groups. And as we gain clinical evidence, we can then market to insurance companies and medical groups who are interested in decreasing the cost of care for those patients and tracking outcomes. So we have a team with diverse backgrounds, everywhere from education, psychology, engineering, and even business. And we're all unified by our passion to bring evidence-based therapy to patients and make a difference in these patients' lives.
So looking at the next phases of our actual product development, we really need to initially go and expand the expertise of our team. And that's going to start by adding on a game developer that can ensure that we have an engaging platform for these storyboards that we've created. Additionally, we're going to want to gain some additional expertise in ABA therapy. From there, we acknowledge that we have significant risks around data security and storage, and we want to make sure that our product is HIPAA compliant. But finally, we want to formalize some of the initial relationships that we've already established to ensure that we have a consistent testing population that we can use as we test out our pilot. At Aaida, we truly believe that we can provide affordable, accessible, and engaging therapy so that Brent and the millions of families like his will be able to receive the care that they deserve. Thank you.